Hi everyone, my name is Kayla and I'm going to be talking about overcrowding in the emergency department. So as we know, the emergency department is there for immediate medical attention, including life-threatening injuries, broken bones, and it's always staffed. Overcrowding in emergency departments is a critical issue that impacts nursing, patient care, and overall health outcomes. As the front line of acute care, nurses in overcrowded EDs face increased workloads, heightened stress, and limited resources, and this can compromise patient care quality. Delays in treatment, reduced patient satisfaction, and increased risk of medical errors are expected consequences of overcrowded conditions. This creates challenges in maintaining patient safety, efficiency, and adherence to best practices for nursing. Ultimately, overcrowding can lead to poor health outcomes, highlighting the need for effective strategies to alleviate pressure on EDs and optimize care delivery. The 5 articles that I reviewed analyze ED overcrowding, its causes, and potential solutions. Studies by Sarantini and Imprata highlight systemic inefficiencies and the role of overcrowding measures, suggesting that there's gaps in current nursing practices related to resource management and patient triage. Jung revealed that overcrowding impacts care prioritization, calling for improved triage systems and ED workflow. So together, these articles emphasize the need for evidence-based strategies to streamline patient flow, improve care delivery, and reduce overcrowding in the EDs. Addressing ED overcrowding has a significant potential impact on patient outcomes and nursing practice. By improving patient flow, triage system, and resource allocation, this can reduce patient wait times, leading to faster and more effective care. And this minimizes risks associated with delays and enhances patient satisfaction and overall care quality. For nursing, implementing evidence-based strategies to manage overcrowding allows for more efficient workflows, reduced burnout, and improved decision-making, ultimately creating better patient outcomes and work environments. The objectives for reducing ED overcrowding focus on improving patient flow and staff efficiency. By aiming to reduce patient wait times by 15% in 6 months, this goal is clear and obtainable and ensures measurable outcomes. This includes strategies like triage improvements, increased staffing, and data-driven scheduling that makes the goal realistic and achievable. These objectives align with improving patient care and satisfaction while addressing staff workload and burnout, ensuring a practical approach to ED overcrowding with a defined timeframe. A cohort study would be best for this proposal. This design collects data from patients entering the ED over a defined period. It tracks their care pathways, their wait times, and outcomes to overcrowding metrics. It also allows for real-time monitoring of the overcrowding effects and the impacts of the interventions. This design is suitable because it enables the evaluation of process changes, resource allocation, and patient care outcomes, directly aligning to improve ED efficiency and patient flow. Implementing an enhanced triage system with real-time capacity monitoring is an evidence-based intervention to reduce emergency department overcrowding. This involves assigning staff for continuous triage updates and integrating predictive analytics to manage patient flow better. Based on the articles I reviewed, improving triage accuracy and adjusting staffing during peak hours is essential. This aligns with evidence-based practice guidelines by focusing on timely care, reducing wait times, and optimizing resource allocation, which is critical to improving patient outcomes and ED efficiency. This approach also uses overcrowding measures as suggested by studies like Imprata to track congestion levels in real time and adjust staffing and resource distribution. This ensures that the ED staff can manage high volumes effectively. To evaluate the effectiveness of this proposal, data collection should include patient wait times, length of stay in the ED, and admission rates pre and post intervention. Surveys of patient satisfaction and staff workload should also be collected to provide qualitative insights. Data can be collected through the EHR or feedback forms that are provided. Wait times and patient outcomes will be analyzed using a technique like a t-test to assess improvements. Ethical considerations should be assessed as well. This includes patient confidentiality, informed consent, and ensuring unbiased data analysis to maintain the integrity of the study. Additionally, any patient or staff identifiers should be kept anonymous to protect privacy. So the expected outcomes of implementing this proposal are improved patient outcomes, more efficient ED operations, and enhanced nursing practice. By reducing patient wait times and optimizing resource allocation, the intervention aims to improve the quality and timeliness of care, enhancing patient safety and satisfaction. For nurses, this can lead to reduced burnout and improved workflow. Additionally, by streamlining ED processes, healthcare delivery becomes more cost-effective, minimizing any unnecessary admissions and improving overall resource use within that department. In conclusion, this intervention aims to improve patient outcomes, reduce nurse burnout, and increase cost-effectiveness in healthcare delivery. By addressing the challenges of ED overcrowding, the project has the potential to impact nursing practice and the quality of healthcare services significantly.